And then wanted to talk about advances in diagnosis. So the FDA is really important in developing new drugs for us, but they're also really important in developing new diagnostic treatments. And so this is work that was put out from Cincinnati, and essentially they took mucosal biopsies and then put them through a series of extraction techniques. Were able to take the gene information of different cell types that were in the mucosa and then run it through a signature analysis that looked at the expression of all of these genes. And what they're attempting to do is to say, can we, rather than look under the microscope, can we take a piece of tissue from your esophagus and with that tell you whether you have EoE, GERD, or what have you? And what they were really able to show, is that you can tell a difference in the genes that are expressed between eosinophilic esophagitis, which is on the right, GERD, so gastroesophageal reflux disease, NERD, which is non-erosive reflux disease, so it means your pathology is totally normal, but maybe you responded to PPIs, and then just normal healthy patients. And what you can see is that there is a difference. The dilemma though, right, is that still requires a biopsy. So it's still a mucosal tissue. And so it would be awesome if we could have something that did not require our patients to have to go through so many procedures. And so work that Dr. Glenn Ferruta is working on with his lab is something called the Entero test. So this was developed in the 1970s, way before I started my pediatric GI fellowship, but it's a tool that has been out there for a long time, and it was originally developed to be able to test for parasitic infections. So essentially, you would tape a little bit of string at the side of the person's mouth, you would have them swallow the capsule has a long string, it would go into their intestines, kind of sit there for a while, and then you'd be able to take it out and kind of test for whether there was parasites at the end of that string. So in this case, this has been adapted. So the string is swallowed, so very similar, same way, it's taped to the face, and it's allowed to kind of go all the way down. For the initial studies, the string was swallowed the night before an endoscopic procedure, and then at the time of endoscopy, the string was then removed. The fluid from the string was frozen, and esophageal biopsies were obtained at the time of the procedure. And so what we're looking for is when we take that string out, rather than worry about what's in the intestines, we really care about what's on the esophagus. And so looking for the proteins that are expressed by eosinophils, and can we look for them on the string and find them? And how does that correspond to what we find when we do a biopsy? And so essentially this is just one piece of the results that have come out of this, but essentially saying, the first question, right, when you have this is does it work? Can we even capture these proteins from eosinophils on this string? And indeed, they can in the lab. And so, and it's specific to the esophagus. So they can look for those proteins that are put off by the eosinophil, and they can capture them in the eosinophilic esophagitis patients.